Hello, pediatric surgery family. I'm M. Gootee from Cincinnati Children's Hospital Medical Center. And today, our team is going to deliver the articles that you should know about. We have 3 papers today, but don't have much time. So let's start. Our first paper, titled Appendicectomy versus Antibiotics for Acute Uncomplicated Appendicitis in Children, an open-label, international, multi-center, randomized non-inferiority trial by St. Peter et al. This paper is summarized by Lizzie Lee, a physician associate by profession, and a member of our team here at Cincinnati Children's, dedicated to creating content for pediatric surgery.
Recent literature has been supporting treating appendicitis with antibiotics rather than surgery. This is a multi-center randomized trial in Canada, the US, Finland, Sweden, and Singapore that investigated whether antibiotic treatment is inferior to appendicectomy by comparing failure rates for the 2 options. They found that 34% of children treated with antibiotics eventually required surgery within a year, compared to only 7% in the surgery group. While there were no deaths in either group, children in the antibiotic group had a higher risk of mild to moderate adverse events. The key takeaway is that antibiotics were not as effective as surgery for treating non-perforated appendicitis in children, as it did not meet the threshold for non-inferiority.
Our second paper is Vectoral Screening in Newborns with Anorectal Malformations, an opportunity to optimize screening practices at gynecologic and spinal conditions and utilize a new acronym by Zhu et al. And this paper is summarized by Alex Halpern. He is a research fellow at Children's National and collaborates with us to produce these article reviews.
To try and answer this question, Zhu et al. Used the FIS database and performed a multi-institutional cohort study of all ARM patients between 2016 and 2022. The rates of vectoral diagnoses across all hospital encounters were 45.4% vertebral spinal, 77.4% cardiac, 10.2% TEF, 39.9% renal, and 15.7% limb. 25.8% of female patients had a congenital gynecologic malformation diagnosed. So it seems like the most common anomalies associated with ARMs are cardiac, vertebral spinal, renal, and gynecologic. Due to this, the authors suggest changing the Vectoral acronym to Vector Girls.
Let's move to the last paper of the day. International Consensus Criteria for Pediatric Sepsis and Septic Shock by Schlappbach et al. This paper is summarized by Cecilia Hijena. She's one of the previous research fellows at Cincinnati Children's Hospital.
This is a worldwide study with a Delphi consensus process that aimed to update the definitions of sepsis and septic shock. After multiple analyses, they came up with a Phoenix sepsis score that included variables in cardiovascular function, respiratory function, coagulation, and neurological function. This helped the author correlate the definition with an actual mortality rate. So for sepsis, the definition is suspected infection plus 2 points in the Phoenix sepsis score. And septic shock is sepsis plus cardiovascular dysfunction. That is seen when we have 1 point in the cardiovascular variable of the Phoenix sepsis score. Sepsis meant a mortality of 7.1%, whereas septic shock implied 10.8 to 33.5% according to the research settings.
Thank you for listening. Please check the link in the description below to read each paper. We hope you liked this episode. Please follow StayCurrent MD on social media, give us a rating, and subscribe to our YouTube channel. And don't forget to download the StayCurrent app on the App Store or Play Store for tons of content.